Please tell me that I can't, that I won't, that I fail, that I'll never make it out, yeah. Please tell me all the bad, never good, fill my head full of...
4 years ago, I had tweaked my back as I was helping one of my personal training clients with a barbell. Unfortunately, I ignored my own advice in handling every weight as if it weighs exponentially more than what is tagged. And immediately, I realized my mistake. Having been a collegiate athlete and a Navy veteran, I became really good at hiding pain, so my client had no idea. When we were done with our session, I proceeded to do my own workout, which that day it was a leg day workout. This time, I couldn't ignore the pain anymore and had to end my workout early. As the day went on, the back pain got worse and worse, and when it was time for me to train my evening clients, I let them know that I would be really limited with how much I could help them in grabbing and putting away the weights because of my back injury. Moreover, I had to make immediate changes to their workouts that didn't require me to spot them, such as heavy squats and bench presses. The thing is that low back pain is a really common condition that affects millions of Americans and significantly alters the way that we do many of the things that we usually do. And until you get that experience of what it's like to struggle with back pain, you should probably still pay attention to what I've got to say. Most cases of back injuries come from a gradual accumulation of poor lifting techniques, and that's what I believe is what happened with me. I laid the groundwork with weeks and months and years of admittedly inadequate lifting technique of heavy objects, and handing my barbell to the client was basically my last straw. Welcome to the Workout Nerd Out. I'm Julio Lopez. I'm a certified strength and conditioning specialist, a certified personal trainer with over 8 years of experience in personal training. And I've got my master's degree in nutrition. The fact is that most people over age 30 have at least some level of disc herniation going on in their lower backs. For the vast majority of these cases, depending on the intensity of the pain, most back pain cases don't require surgery. So don't freak out on me. In fact, with simple exercises and careful adherence to good lifting technique, this can help reduce some of the pain. Increasing strength in back extensor muscles, as well as the glutes, one can notice a drop in back pain, and my favorite exercise for making this happen is none other than the hip thrust. Dr. Stuart McGill, a renowned expert in recovering from back pain, and physical therapist Dr. Aaron Horschig frequently talk about gluteal amnesia as one of the most common techniques connected to the cause of back pain in athletes and recreational lifters alike. According to Dr. McGill, many lifters fail to adequately train the glutes. Eventually, they inadvertently teach themselves to perform lifts while excluding gluteal muscle involvement, such as the deadlift. When the glutes are excluded from performing deadlifts, the body primarily uses the hamstrings, which is the main target muscle for the exercise, and the lower back, which is not the main muscle that you want to target. Over time, especially with heavier loads, the lower back muscles fail to maintain core stability, thus causing movement going on in the spine and elevating the risk of injury. Whether you knew it or not, the glutes are actually considered to be part of the core. Separated into 3 parts, the gluteus maximus, medius, and minimus, the glutes are vitally important in stabilizing the pelvis and the spine. Having weak glutes can alter movement patterns, therefore leading other muscles to compromise and increasing low back stress. By training the glutes to become stronger, you can effectively improve hip stability and reduce the strain on the lumbar spine. You know that evolutionary diagram that starts with an ape walking on all fours and eventually transitioning into a bipedal human being? Notice the difference in muscle size of the ape and the human. Apes have no booty. That's because the glutes are what allows us to stand up straight. People that work sedentary jobs and live a largely inactive lifestyle are more likely to have poor posture because there isn't much necessity for their glutes to be strong, nor are they doing anything that can help to preserve glute strength. So the posture suffers. When the glutes are weak, this can contribute to anterior pelvic tilt or lumbar lordosis. Think of Instagram models that stick out their butts. Since this posture doesn't coincide with the human back's natural curvature, this creates uneven stress, mostly in the lower back, which means the intervertebral discs are squeezed unevenly, which may result in chronic back pain. The benefit of including hip thrusts to your training routine is that they strengthen the glutes, which can help to reduce the severity of lumbar lordosis and anterior pelvic tilt. Especially when holding the top of the hip thrust, core muscles have to work in overdrive in order to maintain core stability and rigidity. Otherwise, the individual wouldn't be able to keep the barbell up. Strong glutes contribute to core stability because they work with the abdominal muscles and back extensors. Remember, the core's purpose isn't to look sexy in a magazine or Instagram spread, but rather to protect the spine during movement, which is how you can reduce risk of low back pain. The back extensors are the muscles located lining the spine. They're crucial in supporting the spine when lifting, bending, and maintaining proper alignment. Exercises such as suitcase walks, planks, and hip thrusts can help strengthen back extensors, as well as to help reduce pre-existing back pain. While hip thrusts are predominantly a glute workout, they also require involvement from back extensor muscles. At the top of the hip thrust, the back extensors must contract isometrically to maintain spinal alignment, as this plays a huge role in maintaining stability. Through consistently including hip thrusts in your training program, this can help increase strength in the back extensors, which means better spinal stability and reducing the risk of low back pain. Combining stronger glutes and back extensors leads to a more balanced and resilient posterior chain. A more resilient posterior chain means lower probability of injuring one's back. What is it about hip thrusts that makes them so effective in reducing back pain? Much has to do with shifting the load from the lumbar to the glutes, which minimizes the strain on the lumbar spine. The glute max is the largest muscle in the body, and ignoring the glutes to use the back to lift heavy objects is as illogical as it sounds. But that's what so many lifters and athletes do. By strengthening the glutes and improving load distribution, hip thrusts can contribute to a healthier and more stable lower back. One of the things that you have to remember is that although hip thrusts are great for helping to reduce back pain, this doesn't mean that they can't worsen back injuries when poor technique is observed. One of the most common hip thrust errors is allowing the back to hyperextend, meaning that the torso crowns at the top of the hip thrust and the intervertebral discs are unevenly pinched, thus leading to chronic back pain. Engaging the core and by going into a posterior pelvic tilt keeps the spine neutral, and this ensures optimal glute activation while minimizing stress on the lower back. Since the glutes are such large muscles, it's normal to see rapid increases in load possible for most of my personal training clients. But I have to make sure that we pump the brakes when this happens. While progressive overload is essential for muscle growth and strength development, progressing too rapidly or using excess resistance can strain the lower back and lead to pain. For most people, this means increasing the weight by about 2 to 5% per week as opposed to 10 to 15%. The goal is to make strength and muscle size improvements as safe as possible, because trying to go too fast is one of the leading causes of injuries, especially with hip thrusts. Are hip thrusts safe for people with herniated discs, particularly the L4 and L5? In most cases, they're absolutely safe, but considering the location of the herniated disc or discs, this means that you have to be more careful. In this situation, I would advise a person with a pre-existing injury to simply work on bodyweight hip thrusts for the first 2 months after they're introduced to the exercise. I need to be absolutely convinced that they have mastered excellent technique, such as exhibiting a proper posterior pelvic tilt. Then, start with dumbbells before using the barbell, while keeping a close eye on the lower back. Since everyone is different, the time it takes to learn good technique and increase load is going to vary. In conclusion, as we grow older, back pain becomes more and more likely, especially if you worked a physical labored career or been physically active for a considerable amount of time. While some folks hit the lottery and never experience back pain, for the rest of us, it means having to search for solutions to reduce the intensity of the back pain. Being a personal trainer, I knew that prescription drugs would only mask the pain, which is why I took a deep dive for exercises, and that's how I found the hip thrusts. Prior to my back injury, I thought that they were nothing more than a fad for booty building, but I was pleasantly surprised at how wrong I was for having such a misinformed opinion. My advice to you is to make sure that you learn excellent technique when performing hip thrusts, and to be patient with increasing the load. With consistent inclusion of the hip thrusts in your training routine, there's a good chance that you may be able to reduce your pain and live your life more comfortably. So that does it for today's Workout Nerd Up. If you have any questions, feel free to leave it in the comment section. And don't forget to hit that like and subscribe button. Until next time, I'll see you on the next Workout Nerd Up.